Good morning. It is still Friday, the 17th of October 2025. And if you thought last year or this year, 25, was bad, you wait till next year because look at all this garbage that they're putting this way. I've just done a video on the mental health crisis that Australia is encountering at the moment and what they're planning on doing with that. And it's all linked to superannuation and money. And here we've got SK, which is South Korea. Biosciences begins global phase 1 out of 2 or half trial for universal COVID vaccine. Wow. And look when it is. 2 days ago. I got this yesterday and I was horrified. It came through on my Google alerts and I was absolutely gobsmacked and horrified. If you thought that they were finished with all of that garbage, I'm sorry to tell you, but they're not. They're finding ways. They've recognised that the gene therapy, I'm not going to call it a vaccine because it's not, it's gene therapy, was very, very experimental, that it wasn't perfect, that it was dangerous to a lot of people. And now they're finding ways, and a lot of people are hesitant. So this is a one shot. You don't need 2 jabs for this, you only need 1. And so they're doing clinical trials and they're starting here in Australia. Yay! How lucky are we? We're A up the top. Maybe we're A plus because we're morons and we fall for this garbage. And our government is incompetent and is complicit with them because our so-called Prime Minister is so weak and he is so mediocre. He doesn't even deserve to be spoken about. He's a pathetic man. He proudly claims that, he look at me, I can become Prime Minister. Anybody can become Prime Minister. Don't worry about that. Yeah, but he grew up in a housing commission. So he's been on the taxpayer's tit all his life. I'm not saying anything about his mother. God forbid her. But I'm just saying he's grown up where the government has paid for everything, funded and been his daddy all his life. And I'm sure that they've been a daddy in a very bad way too. But anyway, let's have a look at this. So SK Bioscience has said on the 15th that it will enter clinical trials for universal vaccine that responds to a range of viruses, included COVID-19 and SARS. It submitted a plan to Australian authorities. Wow, the Australian authorities, which is our TGA, I'm sure. Therapeutic Goods Administration. I'm pretty sure that's who it is. For a global phase 1 out of 2 or half trial of the universal vaccine candidate, GBP511. The trial will enrol 500 healthy adults aged 18 and older. So 500 people they're going to try to rope in to do clinical trials to see if this stuff is going to cause any harm to people, to see if it's effective. As to what effectiveness is, if the effective is to make people sick, if effective is to make people unwell, if effective is to make people perhaps not breathe anymore, then it'll probably be fantastic. But if it's meant to stop disease, I'm just looking at this and it says the company received 90 billion won. They didn't when gifted it, they won it in initial research. Won. Why would they use the word won? It's like it's a prize, it's a gift. They won it. Wow. Well, I will hold my breath and wait to see when that happens. Okay, I am a skeptical cynic because of the way the government's treated us all my life. You grow up, you think. The first people that lie to you are your parents. They tell you about the Easter Bunny, Father Christmas, and they use, threats and coercion to make you comply as a child. If you don't behave, you're going to be on Santa's naughty list. No presents for you. What do? You comply because you want a present. You don't want to be on Santa's naughty list when you're a little child. Yeah, it's all lies, and your parents have indoctrinated you very, very well. But anyway, so it's going to go through to 28. Wow, we're only in 25, nearly in 26. So you've got 2 and a bit years of this garbage. The company, which is SK, I'm assuming, received 90 billion worth in initial research. $90 billion. Now, all of this money, $90 billion, they don't say whether that $90 billion came from Australia or whether that was globally. They don't expose. Maybe I'm doing, subliminal slips here. But $90 billion, that's a hell of a lot of money. How many houses? How much infrastructure could you do? How many hospitals? How many schools? How many, therapeutic places could be built that are safe and are very, very effective because they're community based. They're not pharmaceutically based, they're chemically based, as in, they're done by the community. This is ridiculous. And development funding it came from the Coalition of the Epidemic Preparedness, CEPI. Oh, and who funds CEPI? Isn't that the Bill and Melinda Gates Foundation? Yeah, and remember Bill Gates said, when the next one comes, you'll know about it. Oh, you think COVID was bad, wait till the next one. And that smirk on his face. So, yeah. Okay. CHA Vaccine, an affiliate of CHA Biotech, said on the 15th that the Ministry of Food and Drug Services Safety for clinical trial, blah, 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 the shingles. So they're doing shingles as well. So they're not just doing, this is SK, South Korea. Now they're doing clinical trials for a universal COVID vaccine. They're doing clinical trials for shingles vaccine. And they're for people over 50 and also for people over 65. So very, very scary. So when you listen to all of the experts saying, they want to give everybody about 120 vaccines every year. I don't know the exact number, but a huge number. And it's going to be a compulsory thing. And if this digital ID becomes part of our life, they'll say, you're 50 now, it's time to get your shingles vaccine, and your money will shut off. You won't be able to go anywhere. You'll be distanced from society until you take that shingles shot. And then when you hit 65, unless you take this shot, the next one, you shut off. You haven't passed that test yet. You're not cleared. This is the future that they have for us and for your children. Think about it. So, do you think the government that we have right now is working in your best favour? Do you think that they're protecting you? Do you think that they're trying to give you a better future? Look at the number of people they're bringing here. And I'm not talking about the people where they come from. I'm talking about numbers. They're bringing over 1,000 people a week to this country. And we don't have enough infrastructure, housing, food, jobs, medical services. We don't have enough of anything. All we have is a huge abundance of land that nobody can live in. So this is really, really scary. So they're doing another clinical trial here for what? For reflux. Since when do you need to, if you have a bit of reflux, and you've got to take one of those chalky pills because you've got a bit of acid in your guts because you haven't eaten very healthy, or you've had too much alcohol, or whatever you've done, you haven't really looked after your body. Now they're going to give you a vaccine to stop that from happening. How lucky are you? You don't have to take that horrible Gaviscon anymore. You can just get this vaccine. Don't worry about it. It'll be sweet. Acid secretion. Okay, there we go. That's scary. I can understand if you've got erosive, so your stomach is being eaten by itself. It's sort of in a way like cancer, I suppose. But that's really scary. And it's the Catholic University of Korea. Wow. That's where being Catholic, I'm not going to get into a religious thing, but Catholic, let's just say they're not the most holy, are they? Full of holes maybe, but not holy. Okay, and then there's another one. What else are they going to do now? Chronic spontaneous urethra. So if you've had that for 12 weeks, then they're going to give you a clinical trial to see if they can get rid of it. I don't even know what it is. It sounds not very pleasant, but I'm sure it's not going to kill you. I don't know, maybe it will, but I just think you wouldn't go into a clinical trial for that. So all of these things here, what else are they doing? All of this was announced on the 15th of the 10th, on the 25. Look at the numerology in relation to that. So it's 25-25. The 10th of October, or the 15th of October, 10 and 15 is 25, and the year is 25. That's 50. Okay. High concentrations of injectable form of blah, blah, blah. It is a non non-narcotic analgesic. Oh, for pain. Okay. They're doing a clinical trial on how they can get things to a non-narcotic analgesic. So this is a pain relief thing. Okay. On a Onpra? Sounds like APRA, doesn't it? Wow, this is really scary. And it just goes on. It goes on and on and on. I can't even go that far. I'm just going to list this email or this note thing, and you can look at it yourself, because I'm just absolutely disgusted that people in Taiwan are doing all of this. But when you look at it, where is it? I did something. Oh, I was thinking, when does the trial, with the WHO, the treaty that we have where they will dictate our medical future, when does that start? Okay, when does the treaty take effect in Australia? Oh, the WHO pandemic treaty does not have a set effective date because it hasn't been finalised yet. But it is not expected to open for signature until at least mid-26. Okay, Australia will only begin its national treaty making process after the agreement opens for signature. I thought it already had. And once the treaty will be entered into force, once it is sufficient number of countries that have ratified it. We don't want it ratified, which means we're stuck to it. When you ratify something, you stick it to you like frigging glue and you can't get out of it. Australia's timeline. Australia will commence its national treaty making process only after the agreement opens for signature. Doesn't give you a lot of information, does it? Okay, we'll get some more information over here. The pandemic agreement will not blah, 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 blah. Okay, these are all in the adoption of the WHO treaty. The adoption of the WHO pandemic agreement by the World Health Assembly on the 20th of May 25 was a landmark moment in global health. Well, global health, I wouldn't call it health. Global control is what I would call it. They should change the word health and put control, because that's exactly what it is. Very, very scary. But I'm really concerned about all of this. I don't mean to scare anybody, but they are going to try that whole situation again. I don't know which disease they're going to have, but they're going to try to make out that there is some pandemic coming, and we've got this South Korean company. Notice it has nothing to do with Europe. It has Asia now. So it won't be AstraZeneca, because they're getting their money in other ways. It won't be the American one. So I don't even want to think about it. All of the ones that were coming out for the COVID vaccines, a lot of those will be bypassed because they're moving it to South Asia and South Korea. They're taking the emphasis off, which is what the governments do. These people here were bad, but these guys are much better. Asian, they're very clean, they're clinical, and we've had no problems with any of their therapies and treatments. So have no fear, Australia. This is clean. And the problem I say, not the problem, but the reason I say it's clean is because, as I mentioned in the other video, and I'll say it here now, there is an Australian company that has found a way to clear the contamination from the therapies, and they're going to highlight that Australia has saved the day. We've found a way to fix this situation because Jimmy Dore and Dr. John Campbell and many others were talking about the number of contamination that was in, and it was, DNA contamination. And not just that, it was any type of contamination from dust and dirt, because they weren't using, sterile conditions, because they really didn't care. They knew that it wasn't, something that was going to be beneficial, and regardless of what they did, it was going to hurt people. But anyway, I'll probably get in trouble for saying all of this. And when we get into the whole, digital ID, I will probably not be allowed to go anywhere because I watch a few people, Richie from Boston. I watch, Alex Jones. I watch a whole heap of Max Iger. There's a whole heap of people that I do listen to. I don't always agree with everything they say, and I don't believe everything they say. But there is a very, very good video, and I'm going to link it this here, and it is from Richie from Boston, and it is the executive doctor from Mr. Yeager from, he wasn't, was he AstraZeneca? Or was he, no, he wasn't AstraZeneca. He was one of the other pharmaceutical companies, and he's talking about the dangers of the digital ID. But anyway, I will leave that for you to listen to, pay attention to, or dismiss. It's up to you. But anyway, look after your family, look after your friends, and don't forget to tell them that you love them each and every day, because they need that reassurance, because the world is very dark at the moment. So I'm going to disappear because I've already gone in my own head. But anyway, Godspeed to all. Godspeed.
Who wants to know?
I am Henry the Red, Duke of Shale, Lord of the Northlands and leader of its peoples.
Well, hello, Mr. Fancy Pants. I got news for you, pal. You ain't leading but two things right now, Jack and shit. And Jack left town.